Elsewhere, the country has recorded 181 new coronavirus cases Monday, bringing the total caseload to 8,067. The new cases were out of the 2,131 samples tested in the last 24 hours. The same period saw 4 more people succumb to the disease, even as 121 patients recovered and were discharged from various hospitals. Ben Chumba with the details.
In the last 24 hours, 181 people have tested positive for the coronavirus disease out of 2,131 samples tested. This brings the number of confirmed cases to 8,067. In a statement by the Ministry of Health, the cumulative number of samples tested for COVID-19 in the country now stands at 191,394. Of the 181 cases, 123 are males, while 58 are females. 178 are Kenyans, while 2 are foreigners, with the youngest being a 4-month-old infant and the oldest is 79 years old. Nairobi has 134 cases, Kiambu 19, Mombasa 9, Kajiado 6, Machakos 6, Lamu 3, Murang'a 2, Uasin Gishu 1, and Kirinyaga 1. Of the 134 cases in Nairobi, Dagoretti is leading with 21, Embakasi East 21, Embakasi South 16, Westlands 11, Starehe 9, Mathare 8, Roysambu 8, Lang'ata 6, Embakasi Central 5, Embakasi West 5, Kasarani 5, Makadara 5, Kibra 5, Dagoretti South 3, Embakasi North 3, Kamukunji 3, and Ruaraka 1. 127 patients have been discharged from various hospitals, bringing the total number of recoveries to 2,414. And on sad note, 4 people have died from the COVID-19, bringing the total figure of fatalities to 164. Ben Chumba, reporting for Channel 1 News.
Moving on, the easing of some of the restrictions announced by President Uhuru Kenyatta on Monday has elicited mixed reactions from Kenyans across the country. From the lifting of the cessation of movement in Nairobi, Mombasa, and Mandera via road or air to reopening of places of worship, Kenyans expressed their views as many hailed the move. Kamche Menza takes a look at some of the views from Kenyans following the news of the phased reopening of the country.
Public transport operators were some of the most affected individuals since the adoption of COVID-19 precautionary measures almost 3 months ago. But the announcement by President Uhuru Kenyatta lifting some of the measures, such as cessation of movement in and out of Nairobi, among other counties, has been met with satisfaction by the matatu operators. At the country's biggest bus terminus, Machakos Country Bus, which is home to most long-distance bus operators, expectations were high.
Siku ya leo tumekuwa na furaha sana kwa sababu rais ametufungulia. Ni kwa sababu miezi 3 tumekuwa na shida kweli. Tumeng'ang'ana juu chini na uchumi na hata kazi zetu ziliharibika.
Booking bado hatujaanza kwa sababu hatujapewa guidelines. Tunangojea tupewe guidelines ya ile kazi vile tutajipanga kikazi tuanze kazi.
The situation is similar across the country as the group is now hoping to recover from the unprecedented losses.
Sisi kama madereva lazima tufuate sheria. Watu wakae social distance. Alafu tumalize hii corona.
Lakini kwa sababu ya vile sasa Mheshimiwa Rais amefungua, kasi itakuwa mzuri na kasi yetu itarudi vile jinsi ilikuwa.
Na wengine wamefungua huko Nairobi, kama mavitu zingine tulikuwa tunahitaji kutoka Nairobi zimefungiwa kwa barabara. Na sasa hii tuna furaha.
Kuna watu wengine wako Nairobi, wako wamekaa huko, na wengine wako wanakaa hapa, na hatuna kazi, na tunafanya kazi ya basi. Hatuna kazi ya basi pia. Na sasa hii tunashukuru rais, bwana rais, tunashukuru kwa Mwenyezi Mungu kabisa.
But even as public transport operators feel the expectations have been met, food outlets owners who normally rely on night travelers feel they are not out of the woods yet.
Bado sijafurahia sana. Ile pahali tunafanya kazi kwa hoteli ni pahali ambapo magari zinakujanga usiku na mchana, na tungeomba ya kwamba hiyo kafio ya usiku pia itolewe.
A section of leaders have also lauded the president's move in reopening the economy.
Kufungua mpaka kuna maanisha ya kwamba pia biashara ya mahoteli na mambo ingine itaendelea kama kawaida, na pia kuwasihi wa Kenya pia wasikize zile sheria zote ambazo zimewekwa na Wizara ya Afya.
Elgeyo Marakwet Senator Kipchumba Murkomen, through his Twitter handle, termed the move to allow the movement in and out of the counties that have recorded the highest number of infections a big mistake. Meanwhile, the National Assembly Security Committee has urged county governments to demonstrate that they are adequately prepared to combat the spread of COVID-19.
There are things which are critical. Even testing with the thermogun, that took the intervention of the chairman to talk to the minister that there has not been any testing until around mid-May, is when the only one thermogun was brought to the border between the county of Busia and Bungoma at Koteko.
And we have been told from time to time, it is for us to take care of each other. And that's why I decided, let me help them until we come and talk and interact and understand what is the real problem.
Kamchemenza for Channel 1 News.